Governors from all over this country recognize that the House bill is a huge cost shift of health care reform to the states. That in my state, the House bill would cause us to increase taxes on state taxpayers between $175 and $200 million a year. We understand that the Senate admits that there's going to be at least a $25 billion tax on states as part of Senator Reid's bill. And for most states, the vast majority of states, that just means a tax increase. I announced my budget for the next fiscal year with a $715 million cut compared to the budget for this year. If I have to have $175, $200 million that I have to pay for expanding Medicaid, then that's going to be a tax increase on the people of Mississippi. There's no place to go for the money, and that's true in state after state after state. And that's why you see governors here from Vermont to Hawaii and from Georgia to Minnesota. And Arnold Schwarzenegger is not here today, but has written a very strong, emphatic letter about the state of California's opposition, as is our friend, the Democratic governor of New York, written such a public letter. So I want to we should be here today to recognize that Senator Reid's bill, like the House bill, guts Medicare and is a huge cost shift that will have to be borne by states. Let me be joined by our Vice Chairman, Governor Pawlenty.
Well, we have an opportunity as governors, Republicans, and Democrats across this nation to be laboratories of democracy and demonstrate ideas and leadership that will work and improve the lives of our fellow citizens. And we all join the conclusion that the American healthcare system is in need of significant improvement. And one of the ways it needs improvement is cost containment. The bills that have come out of the U.S. House and the U.S. Senate are going to end up spending more money, not less. They're going to end up spending, increasing premiums, not decreasing them for most Americans. We need to be focused on cost containment. As Republican governors, we have implemented ideas, created ideas that will help that agenda. You'll hear from Governor Jindal towards the end of this press conference about a series of specific ideas that we think Republicans and Democrats can and should unite on to improve the health care delivery system in our country. But let me give you just a couple of quick insights that I think most Republican governors share. We heard this morning, Governor Lingle facilitated a panel. We heard from a gentleman this morning who talked about the care and precision with which he went through the process of getting a bid and going through the bills relating to remodeling his house. He did it with great care, great precision. And then he talked about the relative lack of attention that he paid to when the bill came for his recent hip replacement surgery, because the amount that was billed to him was almost nothing compared to the overall bill, and he knew the bill was going somewhere else to be paid. So in the case of his remodeling project, he was an informed and motivated and invested consumer, and he took great care to make sure he was getting best value and best results for the money that he was spending. And that was not the case with his hip replacement surgery, because in his view, the financial incentives just weren't there for him to do that. We see that over and over again, and more of that approach needs to be in the healthcare system. We need to empower consumers and payers with good information about cost and quality. We need to give them good information to use the system wisely. And when you see those models tried and deployed and made available to citizens, they make good decisions, and it has a dramatic and measurable effect on costs in a way that makes health care more affordable for our fellow citizens. So as Republican governors, each of us have ideas and have tried ideas in that regard. We think the United States Congress should be following those examples, empowering consumers, encouraging markets, providing help to those who need help, but allow them to make the decisions in the health care marketplace for their families and for their businesses, rather than have the federal government do it. And I just want to also touch on the same point that Haley made. We're concerned about the federal government overreaching and trampling the prerogative of states across this great country. And one of the measures of that is they have put in this bill mandates that are going to drive up the costs for states. Under the House bill is maybe as high as $40 billion, as Haley mentioned. The Senate is acknowledging in their new estimates maybe as much as $25 billion at a time when, of course, state budgets are tighter than ever. And so that's not only going to be burdensome, but it also, from a policy direction, heads the country, in our view, in the wrong direction. So I'm delighted to be here with these creative and innovative leaders, and we're next going to hear from the great governor of the great state of Georgia, Governor Sonny Perdue. Thank you, Sonny.
Thank you, Tim. I don't think there's a person standing on this stage today that says nothing needs to be done about health care. In fact, in each of our states, that's exactly what we've been doing for years, truly lowering the cost curve on our citizens and on our taxpayers in our states. And if you look at our individual states, you can see the examples of that. What we find is about 15% of the people in our state and nation are concerned about access, and about 85% are concerned about the cost of health care. And what these national bills do, both the House and the Senate, is address the 15% without doing anything about the 85%. And when you add millions more people in the federal or in the public program, then that's just going to be putting like fuel on the fire of the whole cost containment issue that will be absolutely non-existent. And they do this by creatively scoring, but they don't count the cost shifting to the states. They have this arcane process of CBO and scoring from the federal budget perspective, but they do it by just sliding the cost off to the states. And that's what governors are extremely upset, both Democratic and Republican governors, about. We understand that it's our taxpayers in our states that will have to fund the mandates coming from Congress, and that's intolerable for all of our states. And I want to echo what Haley and Tim have said. Governor Douglas has done a great job as co-chair of our NGA task force, and we'll hear from him as well. And now you also hear from another member, Governor Mike Rounds from South Dakota, who spent hours and hours in Washington on conference calls with the healthcare task force. It's not, there are things that we can agree on. Obviously, pre-existing conditions, taking people off of health care if they get sick. Those are things that are wrong and we believe should be corrected. But you don't have to totally dismantle and shift the cost to the states in order to address those kind of things of which there's ample consensus.
Sonny, thank you. Look, I think if you talk to any governor in the United States, you'll find an interest in pursuing health care reform, the goal being to provide better services at a slower increase in the cost or even a reduction in the costs. Unfortunately, what we found in Washington, D.C. is that as they move forward with their plans in both the House and the Senate, they have used Medicaid as the tool to provide more coverage for more people. The problem with Medicaid is that it also requires the state to pick up a portion of that cost. In South Dakota, we have a current Medicaid budget of about $265 million. If the House version were to pass right now, that would go up by $33 million a year. I can't afford that. And at the same time, as in the House version, they would, for individuals that are 150% or less of poverty, that would shift 52,000 more people onto the government-run program. These individuals would receive a discounted rate on their health care costs. But the health care cost that's being discounted means that somebody else is going to pick up the bill. In South Dakota, as in other places in the upper Midwest, Medicaid reimburses at between 50 and 52% of billed charges. Now, if your doctor only gets paid about half of what they would otherwise, somebody else is going to pick it up, and that drives up the cost of health care for everybody else. And it's a cost shift that will go on, and it will make it more difficult for individuals to pick up health care in the private market. That is not being discussed, and it's got to be addressed. So today, one of our concerns is when we talk about health care reform is let's take a look at what the costs are that are going into health care, and let's find a way to reduce those costs for the people that provide the health care to individuals. That is not being addressed right now, and that's the focus that we would like to move in the future. With that, today we've also been hosted by a very gracious host, Governor Rick Perry of Texas. They've done a great job of bringing people in, bringing them together, and he's a gentleman who many of you heard yesterday speak on the issues of energy. Today we asked if he would also take some time and speak in terms of health care reform here in Texas also. Thank you.
Thank you very much, and I hope all of you enjoyed your stay in Texas to this point and that it only gets better. As we continue this conversation about health care, we're starting to see the massive financial impact that this has on our country. In Texas, for instance, the House health care bill will cost about $24 billion over the next 10 years. That pretty much wipes out all of the savings that have been put in place in the state over the course of the last 6 years since we passed tort reform. It's rather interesting that the President has been hinting about tort reform. I would suggest that if he wants to do more than just talk about it, that he can come to Texas and see the actual impact of tort reform in a rather large, place. Our 2003 medical liability reforms drastically reduced frivolous lawsuits. It improved access to doctors, health care providers across our state. It allowed hospitals to spend less on legal costs and substantially more on actual health care. There's no question that you have to have tort reform if you're going to have legitimate reform of our health care system in this country. And, you know, you're getting the Republican perspective, Republican governor's perspective here today. But the interesting thing for me is we're certainly not the only states that are being impacted by this. You're seeing skyrocketing costs all across this country if this health care bill passes. And that states with Democrat governors are going to be facing the same cost. They're going to deal with the same federal intrusion into their lives. And, that's what's going to happen if Washington doesn't hit the brakes on this thing. And I hope more of our Democrat counterparts will join their peers like Phil Bresnan and Joe Manchin in speaking out. I know Governor Patterson's written a very powerful letter as well in opposition to this health care bill. Quite frankly, many of the 9 Democratic governors up for re-election this year are facing some pretty massive budget gaps. And this bill that they're debating in the United States Senate today is just going to make it worse. I mean, that is an inarguable fact. When you look at Colorado, it's got $1.6 billion budget deficit, and Massachusetts with a $5.6 billion budget deficit, New York with a $20.9 billion budget deficit, and this health care bill on top of that, it's going to have a ripple effect on those states. And it will be devastating. I don't think there's any way to describe it other than that. We are fortunate with our Republican governors to have what many across the country consider to be one of the most bright, capable, intellectually adept governors in the country, particularly on health care issues. He has an incredible amount of experience gained serving as the youngest ever secretary of the Louisiana Department of Health and Hospitals. And so I'd like to welcome to the podium my neighbor who has my eastern flank covered, Bobby Jindal.
Thank you, Rick, and thank you for your great hospitality. You know, you've heard many of my fellow governors talk about our concerns about the bills both in the House and the Senate. The bills have gotten twice as long through this process. Unfortunately, they've not gotten twice as good as they've gone through this process. Here's our concern. Unlike the federal government, we don't get to just print money. We actually have to balance our budgets. We actually have to pay for the programs that we put in place year after year. The good news is this. There actually is an opportunity to enact bipartisan health care reform that will actually reduce the cost of health care, that will make it more accessible to our people, that will promote the high quality that is already present in our health care system more consistently throughout the entire system. There are at least 10 ideas that I think we could agree with. We're calling on the administration and the Congress to work with the Republicans in a bipartisan way instead of trying to force a 2,000-page bill on a partisan vote through the Senate, as it was done in the House. Let me give you just 10 quick bipartisan ideas that will help us to improve the quality of health care, certainly if we establish voluntary purchasing pools. We know that many of the self-insured, many that are losing their jobs, many that are in the individual insurance market today don't have the benefits of the economies of scale and do end up paying more for their health care than those that work for larger employers who have the benefits of buying more affordable health care. Secondly, portability. More and more people today are moving across state lines, across jobs. It just makes sense that people should be allowed to bring their insurance across those lines with them. It makes no sense to make it harder for people to have their health care when they probably need it the most as they move jobs or move their homes. Third, as Rick said, we need meaningful tort reform to crack down on the cost of defensive medicine, on frivolous lawsuits. You know, we don't need demonstration projects. We don't need interference with the state's ability to pursue meaningful tort reform, but at a national level. If the Congress and the administration would join us in meaningful tort reform, we could reduce the amount of unnecessary procedures, boosting the quality of care, saving tens of billions of dollars. And as you heard Sonny say, fourth, we absolutely need to increase coverage of pre-existing conditions. It makes no sense that when people are sick, when people need their health care the most, it can then often become the hardest to keep their insurance, to buy that insurance. Fifth, we need more transparency in the payment system. We need both prices and outcomes to be posted online on the Internet so that the market can work better. We also need a system that pays for coordinated care, not fragmented care, so we are paying for outcomes. The Dartmouth data shows very clearly that we've got such variability in our healthcare system, we would never accept this. We would never accept this in any other part of our economy. It makes no sense. It results in more spending, poorer results. This is something that needs to be done in Medicare, but it needs to be done across the entire healthcare system. Electronic medical records. Certainly, I want to applaud the administration for their support of investing in technology. This would actually improve the efficiency of our healthcare system, improve quality. This is one of the last parts of our economy, yet it is so important that it is yet to be automated. We're still using paper records that were the standard technology from decades ago. We need to expand the access to tax-free health savings accounts. Many executives have testified to Congress how this has driven down the cost of health care, improved quality, as they put consumers in control, either through health savings accounts, flexible savings accounts. Unfortunately, these bills actually go in the other direction and limit patients' access to these flexible savings accounts where they can be put in control and they have an incentive and a tax-advantaged way to save for these larger health care bills. We need to reward healthy lifestyle choices. We know that chronic illnesses associated with diabetes, obesity, heart conditions are going to be causing a larger portion of our health care spending. We know there are things we as consumers can and should be doing, and there should be incentives. There should be ways for individuals to participate in the savings resulting from their healthy choices. Ninth, we need to make it easier for young adults to keep their coverage. One of the largest percentage of uninsured Americans tends to be young adults who age out of their parents' coverage, yet aren't fully employed, aren't yet in jobs where they can actually afford their own coverage or in jobs that offer affordable health care coverage. There are things we can do to help young adults continue on their parents' policies, would actually keep healthy people in our insurance risk pools, lowering premiums for everybody. And then finally, more aggressive use of advanceable refundable tax credits. One of the things that's true about these bills that are being debated, in one estimate in the House bill, as many as 15 million of the newly covered individuals would actually be getting their care through Medicaid, and that is why you've heard so many governors express their concerns about this mandate on the states. Rather than just expanding separate government-run programs to provide health care, why not help more millions of Americans afford regular private coverage the way that the vast majority of Americans get their health care today? Why not help Americans move out of the emergency room to get their non-emergency care, allowing them to get preventative, primary, coordinated care? We can do that through advanceable, refundable tax credits rather than just expanding Medicaid, rather than just expanding DSH programs today. The bottom line is this. We stand ready to work with the administration and Congress. We're offering bipartisan ideas that really will bring down the cost of health care, really will make health care more accessible to millions of Americans. Those are the stated goals. That's the rhetoric we hear out of Washington. Unfortunately, the bills don't match the rhetoric. We're offering bipartisan ideas that will fulfill those goals. We have several other governors here with relevant experience. Governor Mitch Daniels from Indiana, who, as many of you know, had at OMB in a previous life had a large responsibility, has a unique perspective on out-of-control federal health care spending, has done a lot to cut spending in his state. We've got leadership from NGA as well, and so I'm going to open it up to my fellow governors who may want to come up and offer additional comments before we take your questions.
I'm Jim Douglas from Vermont, and want to offer a couple of thoughts on this topic. First of all, in America we spend about $7,500 per capita on health care. That's twice the average of other industrialized nations. We can do better. And I believe that governors of both parties across this country understand that, And you've heard a lot of the innovations that have been put in place by governors in various states that are beginning to bend that cost curve and improve the quality of care. In Vermont, through our demonstration waivers, we've reduced Medicaid costs by nearly $250 million. We've reduced utilization in terms of hospitalizations and emergency room visits. We've reduced the number of licensed nursing home beds by keeping more people at home and caring for older and disabled people at a lower cost. There are things that governors are doing across America that can be done to really make a difference. But we can't transform a sixth of the national economy by some arbitrary deadline. We can't transform a huge part of what we do in America to accommodate a political schedule. We have to have time to consider the ideas that Governor Jindal and others have offered to make sure we do it right. Secondly, I want to follow up on what Governor Perry said earlier about the impact on state budgets. We're coming out of the longest and deepest recession in the lifetime of most Americans now, but it's not going to be immediate before we get back to where we need to be. Unemployment's going to continue to rise. State revenues are going to continue to decline, and it'll be 5 or 6 years before they're back to their pre-recession levels. Well, governors are making tough decisions, reducing education expenses, dipping into reserves, underfunding pension systems. And if we have an unfunded mandate from the federal government to spend more on a publicly funded health scheme, then those other expenditures are going to continue to suffer. So we have to have flexibility. We have to have a lack of mandates. We have to have opportunities to be the laboratories of democracy. And it's quite clear to me that governors across the country, governors who are Republicans, governors who are Democrats, understand that this is not the way to go to maintain fiscal and economic strength in the states of our country. So we'll continue to urge the Congress to work together on a bipartisan basis to achieve health care reform, but to do it through IT, through delivery system reform, through payment reform, through the kinds of innovations that governors have put in place. And I think we can get where we want to be. Excuse me.
Anybody else? Yeah, Mitch, you want to say something? You're willing to say something?
I'm willing, yeah, I'm willing. Well, you can tell from my violation of the dress code, I had no intention of being part of the presentation today, but as I'll make mention, neither did my colleagues. They've hauled me up here to tell you what is manifestly apparent to you now. I should choose a gentle euphemism, but I won't. This is a fraudulent description of the costs, direct and indirect, of this bill. It ignores the so-called doctor fix. We all know that will finally happen. It ignores whatever the Class Act is. It counts 10 years of taxes, but only 5 or 6 years of spending. Incidentally, on this Medicaid mandate that you're talking about, we all know a sucker play when we see one. The state's share will be relatively small initially, but this is what people told subprime borrowers about their adjustable rate mortgage. We know the balloon payment will come outside the so-called scoring window, and the taxes on our states will be much, much higher even than they would be initially. And finally, you know, the reason that this is so tragically misguided and misleading is that the worst effect in terms of the debt load we leave to our children will, in my opinion, be the depressing effect on economic growth that this latest expansion of government power into regions of the economy we never imagined even a year ago will have. We will only succeed in maintaining an ability to pay our bills and our position in this world if we resume growth in this economy and a commitment really to the private sector that alone can provide it. So I think these things are very, very obvious, but apparently it was my assignment to point them out to you. I will just tell you, I'm probably not the only one who didn't expect to be here talking about this. This is a unique, I think, moment for the RGA. We've not typically intervened in subjects like this, but we didn't know who else would do it. Some of our guests at this meeting have said to us it's a terrible bill, but we're afraid to talk about it publicly. Our business interests would be threatened. The NGA to which we all belong has been paralyzed by partisan reluctance to say what many Democratic governors have said to us privately, and a few have said publicly. And so if not else who, I guess, was the consensus of the meeting that we just had. And We just hope that in some way we can contribute to the national dialogue this morning and say, as Bobby just did so clearly, there are many better ways. There's a far better way forward, and before it's too late, let's find it.
Well said, Mitch.
Thank all of you. We'd be glad to take questions. Sir.
Governor Douglas, you said that we are coming out of a recession. Is that what you're seeing in your state? And maybe Governor Barber, can you talk about that as well?
Well, who knows? Generally, economists will calculate when the recession ended sometime later, but we're seeing now no more free fall. We had a meeting with our economists a week or so ago, and we did not need to further downgrade our revenue projections for the current and next fiscal year. So I think we've found the bottom. But the report from the Rockefeller Institute for Government that came out a week or two ago made it clear that under the best case scenario, it'll be 2013 before most states across the country see revenues rebound to their pre-recession levels. And with all of the other needs that we have to replenish our pension funds, to get other public programs back to where we would like them, to have this unfunded mandate that's so substantial, required by the Congress for a health care plan, is going to put a lot of other programs and decisions at risk.
You know, we saw the third quarter numbers that were announced about GDP. I've never seen a bigger disconnect between Wall Street and the stock market and Main Street and the real economy. Small businesses, middle-sized businesses can't borrow money. You know, $700 billion of money to big financial institutions in New York, and they're taking that money and they're buying and trading assets. I mean, you look at Goldman's profitability, it's all based on trading. They're not lending the money, and the idea, we all thought, was the money would be loaned out to big businesses, but also to small businesses. So it's very hard for us to have any real recovery at a time when unemployment, or more important, employment continues to go down. Our people have lost huge value in their homes and their home equity, and therefore there's not home equity to borrow against, even if their banks are willing to lend against it. And finally, credit card standards have tightened and interest rates have gone up. So when you got consumers with less income and no ability to borrow, it's pretty hard to see how that 71% of the economy recovers in any real way. Sir?
This is for Governor Jindal. Governor, you mentioned that one of the ideas that you have is to prevent health insurers from denying those with pre-existing conditions. House Republicans put out their own competing bill on health care, and it didn't include that. Were you disappointed in that, particularly given that this is one of the bipartisan ideas that you and other Republicans see as essential?
A couple of things. One thing, I was certainly happy to see House Republicans provide an alternative. You've long heard me say that Republicans can't just be a party of no. It's not enough just to disagree. And I certainly disagreed with a lot of the things that have come out of Washington. And I'll speak just for myself, not necessarily for my fellow governors up here. You know, I've disagreed with some of the excessive stimulus spending. I've disagreed with the cap and trade bill passed by the House. I've disagreed with the card check bill. I've disagreed with several of the things that have been proposed out of Washington. But it's not enough just to say what we disagree with. We need to say what we're for. And certainly what I've suggested are, look, there are 10 ideas. There are 10 ideas I think you get bipartisan support. That doesn't mean everybody's going to agree with every idea, but I'm proud that the House Republicans stood up and said, in addition to saying no to this nearly 2,000-page bill, here's what we're for instead. And you've also got individual members, by the way, both in the House and the Senate, that have also offered alternative ideas. I think our point here today, though, is that, and I think Mitch said this extremely well, we are extremely worried about a bill that overreaches, that spends our children's and our grandchildren's money, that doesn't really reduce the cost curve, doesn't really reduce health care spending, and instead increases taxes now with benefits to come later at the expense of our children. We know what's going to happen if this massive bill passes. We know if the spending continues to go unchecked. You'll see inflation go up. You'll see the value of the dollar go down. You'll see interest rates go up. Somebody asked about whether we're we're out of this recession. The reality is this will have a huge impact on our future economic growth. The unfortunate reality is it'll have a huge negative impact. And I think there's an opportunity instead to improve health care in a way that actually helps our national economy. Now, the reality is the House Republican bill didn't include all of each and every one of the 10 ideas, and that's okay. Our point is that let's have a real bipartisan discussion. Our point is to the administration and to the leadership, the Democratic leadership in the Senate and the House, sit down and talk with the Republicans. Let's do this in a bipartisan way. They may not agree with every one of my ideas. There's no pride of authorship. That's okay. And they may have some additional ideas that make sense that we need to add to that list. But the important thing is let's make it easier for people to get access to health care when they need it. Let's make sure that we make it affordable, and let's make it accessible to every single American so they don't have to choose between going to an emergency room and not getting the health care they need. It's more expensive, and it's not the best health care for them. Thank you.